The back has two main parts, the back muscles and the spine. The spine consists of bones known as vertebrae, which are joined together by the facet joints and discs between each vertebra that act as shock absorbers. Risk assessment is required for all manual handling tasks. We use the TILE term to assess the risk. This stands for T, task, I, individual, L, load, E, environment. Never undertake a task that you consider to be a danger to yourself, your colleagues, and the patient. There are also environmental issues that we need to take into account, such as floor or surface conditions. Are they slippery, wet, obstructed, uneven or worn? Are there any steps or ramps along your route? Is there sufficient lighting? Heating conditions. Is it too hot, cold, or humid? If carrying or moving a load, is the load heavy, bulky, or awkward? Is it difficult to grasp, have harmful sharp edges, or is it too hot or cold? Is the load badly stacked or too high to see over? Lifting a load above chest height is also dangerous as you can't get the load close. You are less stable on your feet and it puts too much stress on your lower back. Get the patient to turn their head in the direction of the roll and place a patient's arms in the appropriate position. Near side arm flat against the body and far side arm placed across the body. Get the patient to bend their far knee if possible or cross the leg in the direction of the roll. Place one knee on the bed at the middle of the patient's torso, one hand on the patient's hip and the other on their shoulder. Now roll the patient towards you with a gentle but positive movement. Allow the leg on the floor to bend to facilitate the weight transference. With a colleague mirroring your actions on the other side of the patient, place one knee on the bed, facing the patient at their hip level. The other leg should be on the floor, slightly forward over the knee to ensure a good solid base. The patient should hold onto the carer's upper arms just above the elbows, and the carers should hold the patient's elbows. The patient should bend their knee slightly and tuck their chin into their chest. On command, the patient then pulls themselves up into a sitting position as the care workers lean back, sitting onto their heels. The care worker should be positioned close and slightly behind the patient. Place your hand on the patient's hip or lower back. Place the other hand on the front of the patient's shoulder or elbow, or get them to rest their palm in your palm. Your position will guide and reassure the patient as they walk, and from this position you will be able to react if anything goes wrong.